Good afternoon, everyone, and thank you for joining our weekly New Hampshire COVID Vaccine Alliance Zoom calls. We've been holding these since mid-December, so happy 4 months. We're going to do just a really quick revamp for those who are new to this call. Again, the intent of this is to convene stakeholders across the Granite State to promote vaccine confidence, support accurate and consistent vaccine messaging, and foster coordination of the vaccines allocation process. To do that, we seek to promote public buy-in for the COVID vaccines to increase immunization rates. Most importantly, try to act as a force multiplier to promote the state's vaccine communication allocation plans. Third, to counter misinformation on the COVID vaccines. And finally, and what we'll be focusing on in a little bit more detail today is New Hampshire's new immunization information system. Next slide, please. Again, thank you to our sponsors, Harvard Pilgrim, Anthem, Dairy Medical Center, MD, Wilson's Health Plans, and NH Healthy Families. A couple takeaways from our last meeting. We're now moving into phase 2 of the rollout. So this weekend, the closed pods through the regional public health network started at schools. This will be ongoing probably through, I think, early April as the regional health networks only have limited capacity. A lot of these are happening on weekends and Fridays, so teachers have a day or two to possibly recover from any side effects from the initial vaccines. And so I think you'll see either mostly Pfizer or Moderna for the type of vaccines that are being distributed at these closed pods. And then starting tomorrow through the new VINI system, and that's essentially the state's version of VAMS, will begin tomorrow morning, I believe at 8 or 8:30 tomorrow morning will open. And those in 2A, anyone, school staff or faculty can get in and get into those fixed sites. With 2A, you're required to submit some kind of, just like you were in a hospital setting, you're required to submit some piece of information, either ID or a letter from the school or an email from the school citing that you are in fact a school employee. And so that's how they'll handle those at all the fixed sites, and that includes those maintained by the state and those at hospitals. And on the 22nd, those fixed sites begin and will be complementing what we're doing in phase 1 to finish out phase 1. More importantly, those 50 and older will begin to do the same registration process next week on the 22nd, and those appointments will begin on the 25th. As we mentioned, and was the focus a little bit of our last week's meeting, and thanks to Neil Twitchell from the division, we focused on the strategy for homebound populations. That guidance, which was issued a couple weeks ago, is available at the URL. All these resources are typically at the state's COVID vaccine information site. Next slide, please. Other takeaways for those practices, pharmacy, and hospitals who've signed up to do a provider agreement for vaccine distribution. You can email and inquire at the email address as you see on the screen, c19enrollment@dhhs.nh.gov. Information that we're hearing right now is there's deliberations of when and how the state will begin to pull back its particular role in vaccine distribution and allow more of a private distribution. Those discussions are still ongoing. From what I can ascertain, no determination has been made at that point and when that will begin. exactly, but as soon as they make some determinations, either we'll communicate that information or it'll come through probably one of the governor's press briefings. Again, the 2A guidance is available, and that was updated on Friday in HON Health Alert number 37. And so it does two things in 37. It gives and takes the CDC's guidance and summarizes that for those who have been vaccinated and how they can interact properly to either those who have been also vaccinated or not vaccinated. And then just a reminder, this Friday, on March 19th from 11 to noon, the New Hampshire Business and Industry Association is hosting a webinar entitled Vaccine Distribution, the Employer's Role. And we'll have I have an employer, we'll have one of our epidemiologists on board and myself to talk a little bit more about how employers can be help promote the vaccine. And so we're also, with that, we have developed essentially a joint template for frequently asked questions. And probably the biggest area where this deviates from previous versions is really diving a little bit more into some of the questions on if I have allergies, what do I do? Or more importantly, those for childbearing age. So if I'm pregnant, if I'm lactating, if I want to have a baby someday, those seem to be a lot of the questions that we're getting. And over the last week, we had a series of discussions with a number of school districts. And those predominantly, I think, were the key questions that we were hearing from those in kind of the childbearing years. So a little bit more information on those. If you'd like a copy of those, we'll make them available, or I can send them to you directly. But you can use those. We'll send them to you in a Word document, so you can take and make them your own, either with your own logos, or if you feel that there's other questions that need to be addressed a little bit more. Next slide, please. And so when we do this outreach, typically what we like to do is we like to have a practitioner, a physician who knows that particular audience. So in this case, Dr. Richard Laracy helped us with some school districts that he's a pediatrician for. He did a terrific job. And we've also done similar sessions. We did one for the school nurses with Dr. Elizabeth Talbot. So they'll look a lot like what you'll see on the Friday session. So if you're interested, you're a provider and you'd like to join up, send me your name and contact information. And if we can slide you into one of these sessions, we absolutely will. But we're looking usually for a local practitioner in the area that's identifiable to the population. Some other information where you can go get some more information toolkits include Mask Up New Hampshire under the COVID-19 section. The CDC has just an abundant amount of really great toolkits and information if you go to cdc.gov/vaccines. The New England Journal of Medicine also has some good FAQs on this, goes in one depth. And when we do promotions of this to influencers or those who can have an impact, such as employers, school nurses, principals, or superintendents, and this can also go, we're talking with a number of churches, so clergy also can have a role, as well as local town leaders, we believe can have some role in helping positively influence. So we take and we've summarized in a short slide presentation what's presented from the Ad Council using some of the survey work that they've done and some of the techniques that were most helpful. And really what this is one, allowing folks to know that questions about vaccines are okay and they should be asking them. We want to try to overcome that hesitancy. And number two, this is really not getting back to normal, but this is the new normal. We don't know exactly what that will be, but the inference I use is we go through these changes all the time. Everybody remembers when no one had one of these, and now it's attached with everyone. And so it's just something that changes behavior. The same thing is likely to happen with the pandemic. And so, we're really trying to get back to life, to living, and what that new normal offers. Next slide, please. So I'm going to just try and see if there's any questions about that kind of popped up from that section before we get into the IIS. So the first question is, what time does the registration open on the 22nd? And I believe that is at 8 a.m. That it will start. And the second question, just to clarify, all patients over 50 will qualify. Many patients seem to think that they would need to get a provider approval. Can we message that when we go live? Absolutely. So this is for anyone who is 50 years and older can register, and we'll focus on that, and we'll make sure to get that information back to some of our partners. So the governor, others are really focusing on that message. So thank you for those. So let's jump into a little bit of information. This may not be germane to all of you, but I think it's the important next step, and it's working with the division. This is what we committed to kind of helping promote and making sure that all practice sites would be fully enabled in the New Hampshire's new immunization information system. So it is launching this week. You can see below there is a new website for NHIIS, and you go on and you get all the information we're going to be talking about. There have been communications that have gone out. We're going to summarize some of those just so you have an idea. You can kind of get back to your stakeholders who might have further questions. But again, this is really to the state's system that is going to consolidate patient information, inventory, forecast information, reminders, features, and hopefully to expedite response to outbreaks, not only of this pandemic, but of other more immunizations that we might have and other flare-ups, outbreaks that we might have. So look new and free. Next slide, please. So what are the significant changes? The new requirements for all providers that you're required to dose level reporting for all state supplied vaccines. And you'll have to report vaccination events within 7 business days of administration. Again, that's 7 business days of administration. 2 things that you need to do is when you get in, you have to search for the patient in the system to report immunization doses, or you'll have to create a new patient record if one doesn't exist already. Next slide. So what are some of the other changes? So this is really a change from the VaxNH or the VOMS, which will sunset beginning April 1st. And all the user information, provider information will be transferred from the legacy system into the new NHIIS. To do that, there's really important kind of time frame here. Vaccine orders will be suspended on April 1st until the launch on April 5th of the new system. So that means between now and April 1st, you should have an order before April 1st, at least 4 to 6 weeks of vaccine supply that you would normally do in that time period for all your vaccines. If you can't do that, then you can fax in an order if need be for emergency basis. You'll need to reconcile your inventory by April 1st, and then when it resumes, then you'll catch up that information and move forward in NHIIS. You'll have to continue the monthly temperature logs on the current vaccines that you store. And the vaccine ordering will move to IIS from VAMS, and I believe that process has already started as you move forward. So talking about training now, to be able to use the new NHIIS, you'll have to train and do a online module through the CDC. That's about a 30-minute webinar, followed by a quiz. And you have to successfully complete that quiz, and you'll get a certificate, and you'll have to send that certificate in so that you essentially can complete the registration process to get into NHIIS. All existing users must be trained and pass the question. Again, it'll have a lot of new features that will be brought out from the training. The training is currently ongoing for current users. And this week registration is available to anyone else that you'll like to do. To do the training, this is important, so I'll take an extra minute here. The training is all done through https://www.train.org/cdc.train. Again, that's www.train.org/cdc.train. And it'll follow a 4-step process here that you'll go through. Next slide, please. First slide, again, there's the email address, and hopefully Brian can take and post that up into the Q&A, so you can link directly to that. But you'll go in and essentially you'll create a new account by logging in to the system, and just follow the next step buttons until you get to, again, next slide, the second step. You'll be asked to create a user profile. If you haven't completed the information, it'll show that particular section will show red. Make sure to select the save button to continue. And the most important thing that I've been told that they really want you to do is to opt in to receive the emails from CDC Train. And this will be the basis through some newsletters that you'll get on a regular basis from the department. The third step is actually registering for the course. Here's the next really important number. Search for the number 2021-01. Again, the course number is 2021-01. And that will take you to the course that you need to go through as part of your learning transcript. Then you'll go and have to go through and complete the course, the post-test and evaluation. Next, in the last slide here, step 4, is you'll receive an email of essentially your course registration. Again, they happen at various times. You'll be able to get in to finish. You'll complete that. And the last thing is that we want to see is you need to send in your completion certificate to the department. And if they don't receive that, then you won't get access for ordering. Next slide, please. This is just some other weekly information. Some of you are probably already participating in some of these, but the division also holds 3 other information sessions. And so Wednesdays at noon are the long-term care calls. And then Wednesday afternoons from 3:30 to 4:30, education childcare calls are coming. They'll take specific information from that sector. And then finally, on Thursday from noon to 1, Dr. Chan and Talbot, and usually Dr. Daly will be part of a health providers call. And that information usually gets into more of the science and some of the questions, some of the clinical protocols surrounding the vaccines. And as new vaccines come up or new variants, this is a really terrific, call to be on. So I'd highly recommend you trying to get on the Thursday call if you're interested in kind of hearing really timely updates on the vaccines. Okay, So time for a few questions here. Again, just want to point your attention to the chat. And so you have the www.train.org /CDC train for more information. We have another question here. Should we read anything into the fact that the date of the registration, March 22nd, is no longer noted on that page? Is that date being pushed back? Not that I'm aware of. I'm not sure why it's not appearing there, but all the information that we have thus far is that that's when they're going to allow folks to start registration on the 17th. And then the date that they hope to be giving those out, they estimated was March 22nd. Now, it could be that they're waiting to see, or they've gotten more volume into the the fixed sites from 2A, or they're trying to clean up 2B. So I think realistically, 22nd was it's really the estimated beginning of those when vaccines for the 2B population would start. But I think like all these things, they can slide a day or two. And it's really dependent upon the amount of vaccine that we're getting in and trying to equate that with the registration. So any of those numbers can be slightly off today. For this information, we will post this slide deck and other information on our website at www.nhms.org. Or if you email me at james.potter, I will be happy to send it directly to you. But that information plus some of the other information that we provided should be up this afternoon. If you email me, then I'll get it back to you directly, along with any other information that you like that we've produced. And again, our intent here is to make all this information available to you, so we have no pride in authorship. We just really want to make sure that we're helping each of the stakeholder groups move forward and get as many shots into arms as we can. Again, if we have more information on how those processes are going to shift when we move into the bigger populations, then we'll be happy to provide that information when it's available. But at this time, until they kind of get things up and going, until they make some determinations on exactly how they're going to do phase 2B, and then 3 and 3B, which is essentially the population, we'll have to see. The last thing that I'll say is we did anticipate maybe doing some ad buys with our stakeholders in a beginning about May 1 in conjunction with the 2B site. We're waiting to kind of hear the federal government. The White House has announced that it's going to be spending millions, if not a B of dollars in advertising and promotion of the vaccine. So I think what we'll do is it'll probably be announced in more specifics over the next few weeks. And we'll kind of wait to see what exactly they're doing, because we want to make sure that what we're doing as far as promotion is used most efficiently. So that's all we have for this week. I've done a little bit early, but thank you for participating. Should you have any questions, if you have a particular stakeholder group that you'd like us to work with, if you'd like to work with us in doing it, we'd be happy to share our resources and provide you any experts that we can to help get that information. And we'll also host the webinars or anything else that you'll need to make sure that that goes all smoothly. So Again, thank you for joining us, and we'll see you back next week. Again, look at the other noontime information sessions if you're interested. And in particular, I'd encourage you to look at the Thursday session. All that information, if you're looking for that information in particular, is at the end of HON 37. That's in the information. So all those links and everything are there in HON 37. So again, thanks for joining us today, and we'll look forward to seeing you in a week. Take care.